Hello, I'm Valerie Piet and welcome to another episode of IOHR TV. Today, we're joined by Fernand de Varennes. Fernand is the Special Rapporteur for minority groups around the world. His focus is to work with those groups and work with civil society to try and get the best deal that he can for them. Under COVID-19, we've seen a lot of discrimination and a lot of issues. Fernand, it is such a pleasure to have you here. First of all, what's it been like for you during COVID-19? You are the voice for these people around the world. What's been the most that you've been asked to do?
I think one of the things that is occurring, which has become obvious, is that there are practices which have occurred, which have a tendency of exacerbating already existing inequalities. For example, in terms of access to healthcare, or even testing and information in the languages of minorities, there are obstacles in these areas. Health services, for example, may on a geographic basis not always be accessible to minorities. There are, in terms of access to various testing facilities, or even to resources such as having the ability to wash your hands, or the effects of confinement requirements and accessing financial and other forms of assistance. So we have communities such as the Bedouin minority, for example, in Israel, Roma communities in Bulgaria and Slovakia, and other areas such as even in terms of the Black minority community in the United Kingdom and the United States, where we're seeing practices which have a disproportionate negative impact on these minorities during this period of the COVID pandemic.
What can be done to combat this discrimination now and improve procedures for next time?
I think what actually perhaps one of the things that have been effective or has been contributing in a positive way to is the raising the visibility of these issues, that the virus actually does not impact everyone to the same degree, that there are some minorities, some communities, which for various reasons, including having access to information and testing and health services, that are some communities that are more vulnerable. And I think we've raised, if you will, the alarm on this, and that perhaps next time, hopefully, governments will realize that everyone needs to be taken care of, but there are certain minority groups where specific attention and perhaps more careful and thoughtful steps are taken to deal with their inequalities, which might make them more vulnerable to this particular virus and its consequences.
Some state responses are not taking minority groups into consideration. What's the impact that you're expecting to see from this, and how is the UN planning their response?
Well, you have to understand that when you do not reach out sufficiently and inform adequately or effectively certain minority communities, you have a situation where there is a higher risk of an increasing propagation of this virus. So that if you do not, for example, provide timely, direct, and culturally sensitive information to communities, minorities such as the Roma, they will not be able to perhaps address or prevent the spread of the virus as effectively. It's simply not relying that traditional media or public media necessarily reach them means that you have to be much more proactive in trying to inform them and educate them. So I think this is what needs to be done. We have had unfortunate reports of situations, for example, where you have, in fact, just recently, we have a report where public authorities have used planes to spread to spray disinfectant over a Roma community. There are better ways of doing this, but you have to reach out and you have to be much more directly appreciative of the context and the challenges that these communities have.
The activities of some minority groups have been criminalized, such as the Roma in Bulgaria. What happened?
Well, in terms of even physical distancing, which might seem like a very easy concept to understand and to apply. It's not necessarily always the case. If you have certain minorities that are more marginalized, for example, more vulnerable, they may live in conditions where it's almost physically impossible to keep the distance between them, because you may have a large number of people living under the same roof. Well, technically, you may have situations where you will have public authorities actually penalize and criminalize the fact that there is no physical distancing, whereas in fact, for certain Roma communities, this is almost impossible to actually have. Or in some cases, you have communities, the members of the communities, who actually are not properly informed beforehand. So you have that unfortunate situation where certain requirements during this pandemic actually are applied in a way and in a context which actually criminalizes certain communities such as the Roma.
You stated that the pandemic has exacerbated xenophobia, hate, and discrimination. You launched the hashtag IAmNotAVirus to fight such hate speech and discrimination. What can be done to keep up the momentum of your campaign? And how have politicians contributed to this unfortunate reality?
I think what can be done is to emphasize that we're all exposed to the virus. All of us are vulnerable, some perhaps a little bit more than others, but at the end, it is not useful, nor is it an effective approach to blame others for the spread. Individuals may not be complying with certain requirements, but to try to target and to blame specific communities, as is sometimes occurring with Asians or Roma and others, is actually false. It's not true. And it's actually not addressing if you will, the kind of care and responsibilities that we all have. So I think we have to make sure that within social media, authorities, but also ourselves, we actually do not simply respond to claims that certain communities are somehow more liable or responsible for the propagating of this virus. It's actually not true.
What actions have the UN taken so far to protect vulnerable people and marginalized groups during the pandemic?
The spreading of hate speech, and that in the end is what we're talking about, whether it comes from individuals on social media or politicians or political leaders, has no place not only during this period of pandemic, but no place in society at all. And therefore, I think it is important for the United Nations, for governments and other stakeholders to address hate speech, to condemn it, and to combat it also, which is not necessarily always the case in the most effective way. And what I mean by that is that we all have a responsibility to combat hate speech, the targeting and scapegoating of those that are the most targeted, and those are minorities. And I don't think this is properly understood. What we're seeing from sometimes certain politicians is a kind of instrumentalization of the crisis, but also using what can be described as hate speech against mainly minorities.
How has the pandemic affected the UN's ability to assist stateless minorities? Apart from a travel ban and funding issues, what are the other major challenges that are being faced?
I actually think one of the main challenges is also the need to emphasize how certain minorities are specifically impacted more. As I said or hinted at earlier, it's assumed sometimes too much that the pandemic is affecting everyone in the same way. It's absolutely not the case. Just to be perhaps a little bit clearer, there are studies showing that in the United Kingdom, people from Black or Middle East background are twice as liable to die or to be infected by the virus than others. Because of existing inequalities, it is quite clear that minorities, partially because perhaps they might be amongst the most disadvantaged segments of society or the most vulnerable, are suffering greatly economically and health-wise also. In a sense, what we have here is a situation where we emphasize that we are all in this together, that we are all humans, and that the human rights of everyone, particularly those that are perhaps more impacted, such as minorities, need to be fully understood, appreciated, and respected.
To what extent is the UN involved in gathering, analysing data by ethnicity or race? And as these inequalities surface, do you believe governments will change their response to minorities because the data can't be ignored?
I think the United Nations, we already are working in this direction, and that our efforts are perhaps even more important right now. What I mean by that, for example, is that as part of my mandate, I continuously emphasize in country missions that I have the importance of having disaggregated data based on ethnicity, religion, particularly. And that's important because what this pandemic is showing is that certain groups are more affected, certain groups are more vulnerable, but we need to know which groups are and the extent of their vulnerability if we really want to be effective in combating the pandemic. I have been, in a way, very pleased to see that some governments, I think the German government has mentioned this specifically, that perhaps they have to be much more attentive in obtaining this kind of data to more effectively tackle the virus where it has the most effects, to identify which groups need the most attention and measures to be effective in terms of health prevention or preventing the virus from spreading. So I think the United Nations, this is kind of the message we have to continue, because it is extremely important that we know where the virus is hitting hardest, most.
How does the UN help refugees and internally displaced people in the fight against COVID-19? And are you receiving adequate cooperation from governments?
Well, I think, first of all, whether we're receiving sufficient or adequate cooperation from governments, the answer is yes and no. And some, obviously, there are governments that are more committed, more sensitive, and taking more steps. So I think it's a mixed bag. So there always is going to be a possibility for improvements. However, I think at times there has, in different countries, there has perhaps not have been a sufficient national or governmental awareness of the need to be particularly careful in relation to the vulnerability of refugees specifically, or migrant populations. For example, in Southeast Asia, you have situations where migrants, for example, would tend to be concentrated in buildings and be a very large number of individuals in very dense physical surroundings. They are particularly vulnerable. And I think in a few countries, what we saw was perhaps not a sufficient focus in national efforts to address their particular vulnerability. So definitely, I think some governments needed to do much better about that. In the case of refugees in refugee camps or internally displaced people. Once again, you may have situations where individuals don't have ready access to water. Governments should have, in some cases, been particularly aware of the possibility that the virus would spread quickly in those conditions, and obviously in some cases was not able to respond quickly enough.
There's no doubt that the pandemic is deepening the poverty of minority groups already suffering from economic, social exclusion. Do you see state responses addressing this to provide a sustainable future?
Well, one can be hopeful. I think there are, all of us, because this kind of situation, this pandemic, is of such a scale and speed that none of us really could have guessed or taken perhaps immediately the necessary measures. So there are a number of lessons that have been learned, I think, and that hopefully, particularly if we keep emphasizing that minorities and some other groups of the population need special attention because of these conditions or contexts, I think many of us have actually become more aware and sensitive to that. And hopefully, I think the governments will be paying more attention.
You've been very consistent in your work developing clear and considered measures to help states to introduce practical guidelines. What support can civil society groups give to help drive these guidelines through? And is it advocacy, educational support? What can be done?
Yes, as you know, we have at the United Nations issued some guidelines, some indications of necessary measures that ought to be taken in relation to particularly vulnerable population groups. I think one of the main things perhaps is to ensure that the message and the guidelines that have been developed continue to be so. And what I mean by that is that this situation is not going to be the last one. And so therefore, I think we have to have continuing to use guidelines pointing out and spreading or informing individuals, including governments, that these are the kind of steps that are necessary to address the kind of health crisis or pandemic or similar situations in relation to minorities and others who are particularly vulnerable, such as refugees and migrants. And so therefore, in terms of having access to information in the languages of minorities, having access to information in healthcare for where you have communities that are perhaps have difficulty in accessing normally these are all steps that need to be repeated and perhaps be part of our usual toolkit to deal with health challenges.
Across the Middle East, whole tribes like the Gofan in Qatar have been stripped of their citizenship for historical differences. Do you see raising their case at the World Cup comes closer as being productive, or what else can be done to stop the next generation of stateless tribes suffering the same fate?
I find it interesting and in fact a little bit disappointing that there isn't sufficient, in my opinion, there is not sufficient focus on the human rights dimension here. And what I mean by that is that the decision of who can or cannot be a citizen is not one which is left to the discretion of the state or the ruler. It is one where in particular, the prohibition of discrimination is central. You cannot discriminate in the sense understood in international law when you recognize or strip citizenship. The vast majority of individuals who are stateless belong to a very small number of minority groups around the world. More than 3/4 of stateless people are individuals who belong to particular minority groups which seem to have been actually targeted and denied citizenship. Rohingya in Myanmar, for example. So Roma in Europe, quite a few have problems in terms of obtaining or keeping citizenship. Haitians or Dominicans of Haitian descent in the Dominican Republic is the same thing. They're an ethnic group, and there are hundreds of them who have been denied and still denied citizenship, essentially because they belong to a minority. Russian speakers in the Baltic states. In my opinion, many of these situations probably violate the most fundamental human right in international law, the right to equality without discrimination. And I'm still astounded that we do not talk about this very much at the United Nations. If you're not a citizen, quite often you find difficulty in accessing education, jobs. You might actually be prevented from receiving an education or to being employed. And so given the seriousness of this, I find it perplexing that we kind of still leave it in the air, well, that the decision of nationality, of citizenship, is something left to the discretion of the state. It's not discretionary. There are fundamental human rights that have to be applied here, whether it's in Qatar, Myanmar, Latvia, or the Dominican Republic.
We've seen China's crackdown on Hong Kong. As visiting professor at the University of Hong Kong, how do you see the ability to teach the role of minorities going forwards when universities are being forced to roll back any references that place China in a poor light? Do you think this sort of censorship will stop any discussion of Chinese minorities under threat in the mainland?
Academic freedom to address even sensitive issues is a fundamental component of democracies and open societies. And I certainly think that has to be defended to the utmost, whether it's in Hong Kong, the United States, or the United Kingdom, or France. So I'm hoping that the situation of the academic freedom that I experienced in Hong Kong will continue. And I feel that that's one of the important characteristics that makes Hong Kong what it is, a unique environment where East meets West.
Tell us about the progress in Assam. What's happened since we spoke last?
In India, as you may know, in Assam currently, there is a process in place where millions of individuals may be deemed to be not citizens of India. Not a few thousand, not even 10,000, not even 100,000. We are talking about millions, and their children and perhaps grandchildren. The scale of the situation of millions and millions of new stateless people because of a process now occurring in India is mind-boggling. And if anything, I would have thought that this should be a priority in order to avoid the horrors or the impact on millions and generations of people. And yet we don't seem to talk enough about that situation. And to me, that's actually one of the biggest challenges that we have in relation to statelessness, not only of people today, but also of future generations. And what this means in terms of poverty, of despair, and in fact, despondency and no future, really.
Fernand de Varennes, it's been a pleasure to speak to you. Thank you so much for the work that you do.
It's been a pleasure. Thank you very much for this opportunity.
This is IOHR TV. I'm Valerie Piet. It's been such a pleasure having you this afternoon. Thank you.